Facelift surgery alone can't improve skin quality, and that's a really important factor for giving the patient a truly natural-looking rejuvenation. That's why, here at the clinic, I apply the Hybrid Cosmia Tree Protocol to all my patients, whether they're having blepharoplasty or rejuvenation procedures. This is a treatment that combines the benefits of surgery with the regeneration produced by NanoFat and Cosmiatry treatments, like the ones we do here in the office. Today, I'm going to explain everything about this combination and how it helps patients achieve more beautiful and more natural results. One thing I've noticed when seeing patients who've already had a facelift is that skin quality often goes unnoticed by most patients and even by professionals. In my opinion, having beautiful skin is just as important as having a well-done surgery. I often compare the skin to the icing on a cake. There's no point in making a delicious cake if it doesn't look delicious. And having beautiful skin is exactly like that. It enhances the patient's results and makes those results truly look natural. When I'm going to do plastic surgery, we usually start with the surgical procedure itself. We do the deep plane, lift the brow, do the eyelids, remove the fat pads. And when the surgery is over, I usually treat the patient's skin. What kind of treatment I do varies a lot from one patient to another because it depends on the patient's phototype, skin color, whether they've had any previous treatments, whether they have rosacea or not. So, I start planning as soon as they come in for a consultation. In this case, for example, with this patient, one of her main complaints about skin aging was freckles, those little spots, and sun-induced melanosis. She told me that it looked like she was all covered in little spots. So what did I explain to her? That both freckles and sun-induced melanosis can be improved with gentle laser treatments. There are specific lasers that can be used over several sessions. And in her surgery, instead of doing multiple laser sessions, we did a NanoFat application. NanoFat is that purified fat, which we prepare from the patient's own fat and is rich in stem cells. And what we want is precisely the regenerative effect that these stem cells have. And these are the cells that achieve the kind of improvement we are seeing in the patient's skin quality. When we use NanoFat, I explain to the patient that it's not specific for anything, but it improves everything. It improves skin quality, it improves fine wrinkles, it improves spots, it improves scars, but it doesn't completely solve any of them, because what it does is bring in a new cell. And every time I apply NanoFat, I always combine it with some kind of cosmetic treatment. For some patients, I use the CO2 laser. For others, I use microneedling, those regular microneedling procedures we do in the office, but with slightly deeper needles, right? Because since the patient is anesthetized, I can use needles up to 2.5 centimeters, which are needles that reach a greater depth in the skin. Sometimes I do a peel, and there are several types of peels that can be used. My favorite is always the TCA peel. So, what happens with the patient? When you combine these treatments, surgery, the benefits of NanoFat, and the improvement in skin quality with cosmetic procedures, when the swelling goes down and the scabs from the treatment fall off, she achieves this kind of skin quality. The time difference between the first photo and the second photo is 6 months post-op, which is when the NanoFat really finishes doing what it's supposed to do, which is regenerating the skin. And that's when the patient can really assess her results. So, what do I explain to my patients? That after I perform the surgery, they can go at least a year without needing any aggressive skin treatments, because the skin will already be treated. It will already be under the effect of the NanoFat. It will already be regenerating. So, during that period, less is more. What they need to do is keep their skin well hydrated and use sunscreen, right? Protect themselves from the sun and not smoke. Around the 6 months, if they want to start getting Botox, I think it's totally valid, even for patients who had endoscopic surgery, to start applying Botox to the crow's feet. And as for skin treatments like laser, peeling, Morpheus, it's best to wait at least a year before, let's say, starting the maintenance of your surgery results. In my experience, this is a tool that offers a benefit to patients that, in my opinion, no other technology can really match. And more, I'm convinced that these combinations, combining several procedures along with surgery, are one of the ways to achieve the most natural results. Because we can never forget that when we age in 3 dimensions, we lose volume, we lose bone, our skin gets a bit looser, and the skin itself, on its own, ages as well. When you only do cosmetic dermatology treatments, the ones done in the office, you're just treating the first layer, which is the skin. When you work with fat, you're addressing volumization. And when you perform surgery, what you're actually doing is repositioning the tissues. So, if we stop to think about the logic behind this, the best option for rejuvenation is precisely the combination of all these procedures at the same time. And the best time for this is really during surgery. So, this is the concept of hybrid cosmetic dermatology, which is what we practice here at the clinic, both Eduardo and I. And we do this for all patients who undergo facial surgeries, whether it's eyelids, facelifts, or MAC procedures. And what other criteria we use to recommend hybrid cosmetic dermatology? The patient can't have any active inflammatory disease. That's actually a prerequisite, even for having the surgery. She can't be tan. That's also a prerequisite for surgery. She can't have an active herpes outbreak. When the patient has herpes, we usually recommend herpes prophylaxis, and the patient also can't have active rosacea. And active rosacea refers to those reddish areas on the face that are undergoing an inflammatory process. Having rosacea, we live in a region with a lot of fair-skinned people, so rosacea is quite common here, but it can't be active, it can't be inflamed. When it's inflamed, we have to calm down the rosacea before we can do any skin treatment. But basically, those are the criteria we use to recommend hybrid Cosmiatry. All other patients can undergo the treatment and will benefit from it. We are able to improve acne scars, we can improve melasma, even dermal melasmas that are stubborn and keep coming back, we can get good results. Patients are able to lighten their melasma by at least 1 shade. That's something really interesting, and there's no risk of rebound effect. Yet, we are able to improve those acne scars, like I already mentioned, and regular scars too. Today, I saw a post-op patient who had an accident as a teenager and had a scar on her forehead. So for that scar on her forehead, we applied NanoFat and did microneedling. Just simple microneedling using a 2.5mm needle, and the patient had an amazing improvement in her skin quality, and when she started to frown, the scar was almost invisible. So, this benefit is really something we can only achieve by combining the use of NanoFat, and that's why I like it so much. If anyone has any questions, you can send me a message on direct and I'll reply. Today's live was a bit shorter, and next Monday I'll bring up another topic. Have a great week, everyone, and I'll see you next Monday.